And welcome back. I'm Mabel Jong. You're watching Day 1 coverage of the World Healthcare Congress here in Washington, D.C. In our studio, we have Julie Faulhaber, who is Senior Vice President, Enterprise Medicaid at HCSC, which stands for Healthcare Service Corporation. Welcome.
Thank you. Hi.
Well, tell me more about what HCSC is about.
Healthcare Service Corporation is a group of 5 Blue Cross Blue Shield plans. We serve Illinois, Texas, New Mexico, Montana, and Oklahoma. And we serve the Medicaid populations in those states.
Okay. Now, do you have special projects that are going on right now at HCSC that addresses, particular or unique needs of your population?
We are participating in the Medicaid expansion programs in Illinois and in New Mexico. We also are participating in dual eligible programs, and including the dual eligible financial alignment demonstration in Illinois.
Okay. And what particular challenges or unique issues does that participating in those areas bring up for HCSC?
Well, I think that a lot of those include the long-term services and supports, and including those with all of the healthcare system and integrating that, including the behavioral health elements. Really bringing that integration is so important to the beneficiaries that we serve, but it takes a while to get that all lined up. And a lot of the programs are new, and so that's what we're focused on right now.
Okay, okay. What was the panel that you participated in today?
We were participating on the Medicaid expansion panel.
Yes, and what was your message to the attendees?
Again, there's a lot of talk about integration, a lot of talk about, even though we're talking about the Medicaid expansion population and the states that have expanded, the 19 that haven't, what might happen in the future with those, some new waivers potentially that states would take advantage of was part of the conversation, maybe attract a few more of the more right-leaning states to do Medicaid expansion, and also about the provider element and how providers are trying to engage in the same space as managed care entities to win procurements from states.
Okay.
So those were all of the different elements that were covered.
Well, now, in terms of expansion of the Medicaid programs, what sort of numbers were you looking at, and are you hitting the numbers that you projected?
We're exceeding the numbers that we projected for Medicaid expansion in Illinois and New Mexico. There's still so many individuals out there, though, that are eligible for Medicaid, and so there was a conversation, too, about how to engage folks that may be eligible for Medicaid in states that have Medicaid expansion and they don't even know it yet. And so that was also a fascinating conversation.
Is it shortage of information or maybe not getting the information out in the right way, do you think, or that are posing challenges?
I think so, as well as there's still stigma in participating with Medicaid. And so there's a number of factors that make individuals choose not to enroll in Medicaid, even if they know about it. But there's certainly an element of individuals who don't even know that they're eligible.
Okay. So, Julie, what are some of the other things that you'd like to leave with attendees in this interview?
I think some of the key elements in Medicaid across the board is really focusing on that integration, looking at not only just the acute care, but including the long-term services and supports, looking at the whole person, not just their slice need in healthcare, but how do they fit in overall with the rest of their community, with their family. Really looking at that whole person care is going to be critical for us in working with the population, having them engage with us going forward, and seeing the outcomes that we think all of our stakeholders want.
Do you think you're reaching the right people by coming to this particular Congress? Do you
Yes.
think that the conversations will make a difference?
I think that will.
All right. Thank you so much,
Thank
Julie.
you.
I appreciate it. And I'm Mabel Jong. Thanks for watching.